Welcome to my presentation on developing healthy eating policy. Why do we need a healthy eating policy? A healthy eating policy provides staff, guardians, parents, and families with clear and reliable information about nutrition and healthy eating for children. Having a healthy eating policy in place will assist with supporting children to meet their nutritional requirements, which corresponds to the Australian Dietary Guidelines, meeting the requirements of the National Regulations 168 and 170, maintenance of food and nutrition standards and procedures, providing learning and socializing opportunities, demonstrates leadership and commitment to healthy eating, ensuring that any positive changes to food and eating practices are sustainable in the long term. How to develop a nutrition and healthy eating policy. Following the steps in each of the stages will help to develop or review a policy that reflects the food and nutrition goals and practices. Step 1 is getting started. Form a working group. This group will work together to develop a new policy or review an existing one. The working group should include a director as well as key participants. The group should decide on goals and strategies for the policy within a time period. Identify key stakeholders. A variety of important shareholders should be invited to join the working group. These participants would include parents, families, the centre director or coordinator, cook, staff and carers, and early childhood or healthcare professionals. Involving staff and families in policy planning is important to ensure they understand their role in applying the policy and will support it once it is put into practice. Consulting a nutrition professional can help ensure the policy has the appropriate nutrition emphasis. Step 2 is reviewing current practices and identifying needs. Identify day-to-day practices relevant to food and nutrition. These may form the foundation for the policy. Ensure that your food and nutrition policy aligns with the requirements. Ask the services community for input. Notify all staff and families that a nutrition and healthy eating policy is being developed and provide an opportunity for everyone to contribute. Step 3 is writing the policy. Summarize findings and prepare a draft policy. Use the policy checklist and any other relevant resources to develop a draft policy with an ideal health promoting food and nutrition service for early childhood services. Ensure that the policy is clear and easy to understand, making sure to include any requirements prescribed by state or national licensing and accreditation authorities. Some helpful resources may include the Australian Dietary Guidelines, Infant Feeding Guidelines, National Quality Standard for Early Childhood Education and Care, Get Up and Grow Program, Healthy Eating and Physical Activity for Early Childhood, and Food Allergy and Intolerance. Circulate the draft policy to key stakeholders and invite feedback. Invite staff and families to comment on the draft policy before it is put into practice. Make any necessary changes according to the feedback received. Step 4 is implementing the policy. Put the new policy into practice. Notify all staff, parents, and families about the new policy and display it in clear view. Make any changes required according to the goals and strategies set out in the policy document and ensure that your service is now operating according to each of the policy statements. Some training and professional development or dedicated work time may be required to assist staff members in implementing some of the changes. Identify any practices that are not consistent with the policy, as well as any barriers. Work out ways to overcome the barriers in order to put the policy into practice. And the last step, step 5, reflection and evaluation. Monitor and review the policy regularly. It is a good idea to monitor any changes that have been made in your service due to the new policy. It is also important to determine whether or not the policy is able to meet the short and long-term goals set and whether families, staff, and children are satisfied with the policy. An annual review can help to ensure that the policy is up to date and relevant, and that practices remain consistent with the program. The policy may need to be updated to include new information or corrections. My chosen case study was Australian school canteens, menu guideline adherence or avoidance. The background of this case study explained that globally, authorities have applied school-based nutrition policies to control the availability of unhealthy foods from sale. The aim of this trial was to evaluate the effectiveness of a multi-strategic intervention to increase implementation of a statewide healthy canteen policy. The impact of the intervention on the energy, total fat, and sodium of children's canteen purchases and on school canteen revenue was also assessed. This study employed a cross-sectional analysis of online school canteen menus managed between June and August 2012. All government-funded primary and secondary schools with online school canteen menus were eligible for inclusion in the study. The method used was a multi-strategic intervention or to a no-intervention control group. Australian primary schools with a canteen were randomly selected to receive a 12 to 14 month trial. The intervention aimed to implement a statewide healthy canteen policy which required schools to remove unhealthy items classified as red or banned from regular sale and encouraged schools to fill the menu with healthy items classified as green. At the time of this study, all states and territories used the traffic light system of food labelling in school canteens. This system is reflective of the food classification and principles in the Australian Dietary Guidelines. It involves colour codes where red signifies not recommended or only occasional, and no more than twice per term. Amber indicates select carefully, and green indicates always on the menu or fill the menu. In addition, for most states and territories, confectionery and high sugar soft drinks are banned items. Each state and territory have similar guidelines and policies, but there are different approaches to the implementation. There has been limited monitoring of compliance and satisfaction with the guidelines since their implementation. The strategies included provision of a support officer to assist with policy operations, engagement of school principals and parent committees, agreement procedures with canteen managers, training, providing tools and resources, performance feedback, recognition and marketing plans. Data were collected at baseline from April to September 2013 and at completion of the application period, which was November 2014 to April 2015. The results showed that 70 schools participated in the trial. Relative to control, at follow-up, intervention schools were significantly more likely to have menus without red or banned items and to have at least 50% of menu items classified as green. At follow-up, student purchases from intervention school canteens were significantly lower in total fat compared to controls, but not in energy or sodium. Canteen revenue did not change significantly between the groups. When analyzed by school type, a higher proportion of secondary schools was found to offer red items on the menu. For banned items, there was no significant difference between primary and secondary schools. On the graph provided, the states were all analysed. Western Australia was the most compliant, with 62% of menus adhering to the state canteen policy and guidelines. The ACT had the lowest percentage of schools complying. Opportunities for health promotion practitioners and why it is worth developing the necessary knowledge and skills to work. Staff and student willingness to adopt new approaches, education of key partners and stakeholders to build support for proposed changes, the use of established advocates to help grab interest from students to oblige with the policies, building momentum for proposed challenges to the food environment using social marketing and other communication networks, providing ongoing high quality training and assistance to facilitate the suggested practices, conducting ongoing monitoring and evaluation to support program improvement of efforts, skills working with primary school children and teaching them health and nutrition values to decrease overweight and obesity, learning skills and building rapport with directors, teachers, and parents. This includes networking skills, building networks with different schools and companies. Some challenges they may face may include many challenging interests such as parental views and student food preferences, organizational objectives such as the financial benefit to schools from a canteen operation, complicated and time-consuming administrative practices, limited resourcing of policy implementation, complexity of the nutrition guidelines, lack of controls in systems, lack of engagement and participations with schools and children, and people and problem solving skills, how to solve customer complaints and problems. Childhood overweight and obesity is a worldwide problem that requires many strategies in solution. It is well known that overconsumption of energy-dense, nutrient-poor foods plays a major role in the development of childhood obesity. This may lead to poor food choices and habits which mature into adulthood. There are a range of settings in which children are exposed to environments that offer easy access to junk foods. Schools have continuous contact with children and the opportunity to encourage healthy behaviors. An essential factor of the school setting is the school canteen. Canteens have a high impact on children's consumption, with data suggesting they contribute to the high intake of energy-dense, nutrient-poor foods. Improving food offered in school food service systems is needed as a strategy for reducing childhood obesity. This case study found that the majority of school canteens were not complying with relevant state or territory guidelines, particularly those schools in which no monitoring or enforcement of the guidelines was conducted. Additional funds by government or fundraisers may help to increase participation with schools. Overall, I think that there needs to be consistent monitoring and enforcement to schools for the healthy eating policy. This, combined with efforts to build the capacity for schools and developers to improve the food supply, may increase compliance with the policy. Thank you for listening to my presentation.